So when did you know that Divine Smiles was the right place for you?
Well, first of all, I had a recommendation from my doctor, my dentist who was retiring, who did some research and said some of the background knowledge that Dr. Clancy had was aligned to what he thought would be helpful for my TMJ. When I came here and met the team, they very knowledgeable, they worked as a team, and the testing and what they were looking for aligned with what he told me was going to have to be done. So I was pretty confident on the first visit, and as I was going forward, and I could see that everybody really was looking out for me and to take care of my health and well-being. It was a warm and good feeling to come here.
Awesome. So, and then how do you feel that others will benefit from such a comprehensive approach, having gone through the process?
It was more entailed than I had ever imagined, and not uncomfortable, but they looked at the whole picture. They looked at the jaw, the health of the teeth, what worked in the past, and then with a lot of the x-rays and testing that they had done, they checked for the health of even the upper body. They were looking at the neck, the vertebrae, and how the jaw joint works, and the styloid process and all of that. So I felt that was probably one of the most comprehensive exams I ever really had. And then just the reports and so forth, it just didn't seem like much was left unturned, which was a good thing before we went forward.
Yes, definitely. And how has your treatment and your results impacted you physically and emotionally?
I didn't realize how much I was compromised before I started the treatment. I knew that I needed to address it, and I was getting closer to retirement and changing my lifestyle somewhat. And I thought, I really just do want to be able to be as active as I know I can be. So when I realized it was, once we began the process, once he showed me what needed to be done to get the most out of my life for the rest of my time, I thought, okay, I know I need to do that, but I was really surprised with the energy levels that I had. I was more able to stay on task for the things. I like to be outside and doing those things, but I would tire more easily, and it would be an accumulative effect, so I just had a different outlook after that, I think. I just felt good.
That's awesome. And would you recommend Divine Smiles to friends and family?
I absolutely would. I personally asked, I said, it would be nice if I could share some of this information, because I did a lot of work book-wise before I got here to understand what was going on and what I needed. And I just understood that if I didn't find somebody that could help me, no matter what I did, I was not going to get to the level of health that I could get to, with everything being aligned and working the way it had to align, from my whole spine and my headaches and everything.
Great. And do you have any regrets regarding the financial and time costs associated with the treatment?
I think in our society, we keep dental and health separate on our insurances, so it is. That's always going to be a problem, and it's forces bigger than mine that are going to deem that. At the end of the day, there were so many options, and plans that that were offered with this treatment in this office, that even I was lucky enough to be able to be at a point in my life that I could do that at this time financially. But if I couldn't, there were ways to finance it with very low or no interest rate. So I really felt it is a big time commitment.
Definitely.
And financial. However, as much as it might seem like a lot or overwhelming, it's explained all in once. You understand the process that you're going through. And even though it's almost an hour away from me, the office seems to take into consideration, and when I come in, as much as can be done at that time. So I'm not running constantly. It was very effectively done, and I feel they used the absolute best use of the time and money.
Awesome. And what should someone know about the expertise required for cosmetic dentistry to ensure both function and aesthetics?
You really, really, really need to research what you need and what they're going to do. It's not like, a hip replacement where you might be able to get it done a couple of times. It's sort of like once you make those decisions, that's going to mark the rest of your health for the rest of your time. Whether you do surgical replacement or you do dental work, you really have to know what you're doing and understand your diagnoses before you make decisions like that. But I do find that the doctor has been very good at recommending or saying what he has seen work successfully. And there's no pressure. You make that decision yourself. And you can always talk to somebody else who's been had to go through that.
Yes, definitely. And what do you think would have happened to the success of your case if it was delayed several more years?
Well, as anything that we leave delayed, the problem was just finances would probably change, and as much as the economy changes all the time. I'm being older, perhaps younger, I'm not sure, but for me, when I came here was because I really needed that at that time, so I probably would have lost a lot of the joy that I have in life and my ability to get out and do the things I want to do with headaches and just, it affects the whole system. It does affect your whole body.
Yeah, no, for sure. Alright, and last question, Gail. What would you tell someone who's trying to decide between jaw surgery or full mouth reconstruction?
That's incredibly a powerful question. I have done a lot of research just as a layman, not as a professional, because I'm not a dentist. I've not known of jaw surgery that was really successful. You know, the people that I researched online, spoken to, the pain didn't go away. And I feel like either way you're going to have to change your dentation with your teeth. But if you change your jaw, there's no going back.
Right.
I've had great success this way with the teeth, and I think that that's something that can be worked with and cared for. And the jaw joints, it is what it is. I mean, you can't change that like you can a knee or a hip. And maybe someday they will, but at this point in the time with the medical and dental field, they have not really gotten a good, successful
agreed.
procedure to do that. And even if you do that, you're still going to have to address the teeth. You can change if you change the joint, the teeth are not going to align. So
Exactly.
you know, it's the less, I think the most successful chance I had in my situation was absolutely just to get the reconstruction, and it's done all at the same time, so you're not going back a million times to get it adjusted. It just worked out really well because of the expertise.
Awesome, we're so glad. Well, Gail, thank you so much for doing this for us today.
Well, thank you. I'm the one that asked because I thought I've been through a lot, and to get to where I am and where I'm feeling was worth it. And you know, the expertise of the office. Thank you very much.
All right, awesome.